Right, let's kick off. So I'm looking at the Q&A panel, Mahesh, and the most popular question at the moment, can you see it, is I have extreme fatigue. I don't get excited anymore. I find it hard to get motivated. No sex drive. I haven't had a period for 2 years. I'm 52. Could this be menopause or depression?
Okay. So is that it? Shall I start, Rachel?
I think so, Mahesh, yeah.
Yeah. So for those who were not here last time, I'm Mahesh Perera. I'm a consultant gynecologist based here in Glasgow. I was in the NHS, but have just recently retired and continue to work privately at the Glasgow Nuffield, where I hold my menopause clinics. And there won't be any more plugs after this, promise.
That's okay.
And thank you, Rachel from Menopause Cafe, for inviting me. And also thank you for Ian and Karen from Global Communications. I called it Airmeet, but I think that's the platform we use. And this platform is fantastic. So without further ado, I'll start with the first question about, it's an interesting one, of extreme fatigue, no periods for 2 years. Am I right, Rachel?
Yeah.
Reduced sex drive. There was no mention of any menopause symptoms.
No, they're just asking, could this be menopause or depression?
Yeah. Now, it's a very good question, because it's amazing how much of menopause symptoms overlap with depression symptoms. So it is a good question of asking, how do you differentiate? It is difficult. I mean, typical depression you will have early morning waking, reduced interest, feel down, things like that. Typical menopause would have the hot flushes, night sweats to go with it. Now, in this case, I think it's worth treating it as menopause initially and treat menopause symptoms. Now, there used to be a famous menopause specialist called John Studd, based in London, who passed away recently. And he was a great believer of the effect of estrogen as an antidepressant. Now, don't run away thinking I'm suggesting that, but he had done a lot of work with psychiatrists about this. So I don't think there is any harm in trying HRT and seeing. Now, the issue of libido is a bit different, because both in men and women, the sex drive is thought to be governed by testosterone. Half the testosterone in a woman is produced in her ovaries. So if once one goes through the menopause, you'll halve your testosterone. So that may be a reason.
Right.
And it may be worth a trial of testosterone. Now, in UK, unfortunately, we don't have a testosterone that's licensed for women. So it has to be prescribed off license. And often GPs are not happy to prescribe it.
Yeah.
But if there is a GP with a special interest in the menopause, yes, they would be happy with it. And we use a minute concentration of testosterone in comparison to what men would be prescribed.
Right. Thanks, Mahesh. I think that also answers one of the comments, which was, I was advised to get a blood test for testosterone, but it came back normal.
Yeah.
But what is normal? It sounds like you're saying half of the pre-menopause dose would be normal. So it might be worth asking them I think it was Kyla who asked that.
Yeah, but that was a good one you said. What is normal? We don't know these normal values of these things. And that's why I'm not a great believer in doing blood tests, because the blood test tells us at that moment of time what was that level. It doesn't give us a whole picture. And getting symptoms, speaking to the patient, getting a more global picture is much more reliable than a static blood test.
Thanks, Mahesh. And the same person said, will it help with my sex drive? I think you've answered that. You'd said that testosterone might well help.
But remember, if you go on to antidepressants, that as a side effect would reduce the libido. So you have to be careful that you don't unnecessarily go on to antidepressants.
Yeah. Thank you. I'll just move on to the next one, which has got 6 upvotes. So that looks like a popular one. Oh, I want to know this one too. How can I lose the weight stroke belly fat that has increased during perimenopause? Is there such a thing as a good menopause eating plan that helps with weight loss? Because this is a very common symptom, I believe, Mahesh, that we start putting on weight, particularly on our bellies. We didn't before.
It's not only for women. I had the same problem.
I didn't like to say. We knew each other when we were slim students, by the way, folks.
Exactly.
Yes.
So, unfortunately, there is no easy answer to this. The whole aspect of increasing, as you call, belly fat is a change of the fat distribution that happens at the menopause. You get a redistribution of fat. So from pear-shaped, you become apple-shaped. So you become my-shaped. It is very difficult to change that. To a certain extent, yes, HRT may change to a certain extent. Exercise, I'm a great preacher, but I don't do it. But exercise is, I mean, end of the day, it's a balance of reducing how much calories one takes in and spending more calories, so you get a negative balance.
Yeah.
And then you have to burn the fat, and belly fat would burn faster because it's easy for the body to access it.
Right.
So that, coupled with exercises, they were talking about various exercises of sort of sit-ups and things, but basically sit-ups would promote your the recti muscles and not your abdominal muscles per se. So you need something that would help with the abdominal muscles as well, to build those up.
Yes, I've heard that the core muscles and planks can help. I just get used to feeling hungry, whereas I never felt hungry before. I eat, but I've decided I have to get used to that occasionally for an hour or so.
And this whole business of I'm not an expert of talking about the carbs and keto diets and things. Lots of people swear by it, of how much weight they lose going on these stuff. But there is Nancy, who is on as a participant, recently showed me a publication or some work done by a group called Zoe.
Oh, yes.
On nutrition in the menopause. I haven't had time to go through that. Nancy,
I can the link.
On the comments, if you can put that link you sent me on Zoe.
Yeah. If you can't, then I've got it and I'll send it to everyone afterwards. Okay. The Zoe study is, they also do a COVID study, but they're doing a big menopause study on nutrition. Great. So basically it's tough, guys, seems to be the answer. And it's not just us. Men also struggle with putting on weight at this. Well, they don't struggle. They struggle with trying not to put on weight. I think there is no easy answer apart from discipline and eating healthily and being more active, which are not easy to do, but are good for us, not just for menopause, but good in general. Okay, so let's have a look at the next one, which is I am 50 years old and started Everoel Sequi patches in February. Prior to this, I was having light intermittent periods and had a copper coil fitted. I'm guessing that's the Marina coil. The coil was removed.
No, that's a copper coil is not a Marina.
Ah, my mistake. Okay.
Okay.
The copper coil was removed because it expired 2 days before starting HRT. I have noted that. Hold on, let me read the rest of it. When on the 4th week of patches, Everoel Conti, I have experienced extremely heavy and painful periods, lasting for up to a week. I've just had my 3rd month of patches, Everoel 50. Is this to continue? And would you advise the coil being reinserted? I don't know if that's a question you can answer or if it's too specific. Mahesh.
Yeah, it's a difficult one because the information is not complete. Whoever sent it, if the person's on the attending this function and is happy to come up and ask the question, then that's one way around it.
Okay.
But if it's a copper coil, then that's purely for contraception, nothing to do with a hormone HRT. Copper coils traditionally tend to give heavy, painful periods. So trying to get another copper coil to help with the heavy periods is not going to help. The one thing that doesn't fit into this picture is that she's on Everoel Conti. Now, this sounds to me like this is a lady who is perimenopausal. She was initially on a sequential preparation, Everoel Sequi, which makes more sense. And just looking at the limited information we have, I would suggest that she continues on a sequential regime for a couple of years before going on to a continuous combined regime.
Right. Thank you.
How you do that is immaterial. She could get a Marina coil fitted and be on a continuous estrogen, or be on a continuous, on a sequential oral preparation or a sequential patch or a sequential gel together with utrogestan.
Thank you. I think it sounds like a very specific question, which you might need to discuss with the doctor.
Yeah.
Yeah, the thing is, sequential to start with.
Yeah.
Okay, let's have the next one. There are 3 votes for this one from Alison Bissett. Suffering with broken sleep. Will a rise in estrogen help?
Okay. That's a difficult one. As we get older, we need less sleep. So that's one thing. The problem here is getting up at night, I think. So if she is on HRT, I would suggest she goes on to utrogestan, progesterone type of HRT, because the utrogestan has a slight sedative effect. So taking that at night may help. I don't think taking any more estrogen necessarily is going to help.
Right, thank you. I think learning how to cope with different sleep patterns is something we need to do as we get older, I'm finding, certainly. Yeah. Now, apologies to Marion, I missed your question, which had 4 votes. There appears to be a supply issue, yes, of HRT, for example, Sandrena gel. Yeah. What would the doctor advise as an alternative?
Yeah, there is a lot of problems with HRT. So estrogel, but again, there is problems with estrogel. Sandrena, there is a estrogen spray that's quite good.
Mhm.
But it's not as I find the estrogel more user friendly because you can titrate it easier than the spray. But transdermally or estrogen patches. So transdermally, that's all we have.
Right.
And I would still suggest that the first option should be transdermal.
So that would be a patch.
Yeah, a patch or gel or the spray.
Patch, gel, or spray. Okay, so if they can't get Sandrena, which they're used to, just to try another HRT patch, gel, or spray. Thank you. So this is from Lynn Richards. Hi, Mahesh. I often recommend vaginal estrogen to help with vulval dryness.
Yeah.
And to help with vaginal rugosity. You might need to explain what rugosity is.
Yeah.
Do you agree, or have you got other recommendations? Shall I say that again? Hang on, it's just vanished. Oh, here we go. I often recommend vaginal estrogen to help. Oh, sorry, they're moving around. And now I can't see it.
Who asked that question?
I think it was a Lynn Richardson.
Okay. So if it's Lynn Richards from Swansea,
yeah.
Lynn and I worked together many years ago.
I get that feeling. He's given a thumbs up. So yes, it is Lynn from Swansea.
Yeah. Yep. So yes, I recommend a lot of vaginal estrogen. It's one of the safest things to take, even for women who've had breast cancer. Being on vaginal estrogen often is safe unless they are on aromatase inhibitor. That's the only time I wouldn't suggest a vaginal estrogen. Okay. The question is, what type of estrogen? I mean, the creams which Lynn may be suggesting is something like Western or estradiol, and they are my first line choices. Because the estrogen estradiol is, even if it's absorbed, it's not very active, but it's very active locally, vaginally.
Right.
And what I tend to do is to give an initial 3-month course, but always suggest in the longer term to use it once a week in the long term.
Okay, let's summarize that before you move on, because not everyone may quite get that. So vaginal estrogen is estrogen cream. I think that we can put into our vaginas, and it doesn't increase the breast cancer risk because it doesn't go to the rest of the body very much. It's local to the vagina.
Yeah.
And initially, we might need it fairly often, you were saying, like 3
That's
times.
right. So initially, it's traditionally we use a 3 months course where you take one applicator full every night for 2 weeks, twice a week for 10 weeks. And most GPs would prescribe a 3 months course and then stop it. But I always suggest that they should be on it in the longer term, about once a week, just to keep things at bay.
Yes.
At one time, GPs were concerned if someone's already on HRT, why give topical estrogen on top of that? But there is a lot of good, strong evidence to say the topical estrogens sometimes is needed even in women on HRT.
Right.
There is a new pessary that's in the market, the estriol pessary, called Imvergis. And that some women find it easier because they're used to using Canistan pessaries. So it's very similar shape. There is the Vagifem, which is a small tablet that's inserted. Now, it is very convenient and it's less messy, but it's estradiol. So there is good evidence of safety of long-term use of Vagifem, but because it's estradiol, the more active substance, I maybe I'm just being overcautious. I tend to prefer estriol for longer term.
Okay. Someone has written in the chat that estriol cream is wonderful for her, who's Jane, has made so much difference and has stopped painful sex. I take it as well as HRT patches. So thanks for that, Jane. That would fit with the estriol. Okay.
Oh, by the way, Rachel, you know the spray I told you about? I put it on the chat. The name of it is Lenzetto. Lenzetto.
Thank you. And also in the chat, I see Nancy has shared the Zoe menopause study on nutrition. So Mahesh, I'm just looking for where you typed it in.
I think it has gone directly to Lynn.
Ah, okay. If somebody could listen to what Mahesh has just said, could you spell it out again, Mahesh, and type it into the chat?
Right, I'll put it in our chat.
Right. And then Dinah can put it in the public chat. Oh, Dinah's done it already. Lenzetto. Thanks, Dinah.
All
so
right.
Say that again, because my brain was going off. Menopausal brain fog. That's the spray gel that you were talking about.
Yeah. It looks like a Ventolin inhaler kind of thing.
Yes, I have one of those, right? Okay. So let's have a look. The next two are about weight loss and sex drive. Again, I'm going to go for the anxiety one, simply because we've had questions on weight and testosterone and sex. So that we may come back to them. So Nin has said anxiety not settling, even on 125 patch testosterone, blood showing I am absorbing estradiol level 560. I am 42. Will I need a higher dose? This is for anxiety.
Yeah. No, I don't think treating the anxiety with any higher. And what was the dose? I was not very familiar with the testosterone.
Let's have a look. I'm on 125 patch, testosterone. So I don't know if those are two separate things there.
Okay. Yeah, unless she's on 125 of estradiol or estrogen patch. And that's quite a high dose of estrogen. And if I don't think increasing it anymore is going to alleviate the anxiety, and sometimes one may have to accept the fact that you may have to look at an angiolytic to speak to your GP about it.
Yeah.
There you are. That's 125 Everoel, 0.5 mils androfeme and utrogestan.
Right. So there could be other ways to tackle the anxiety.
Yeah, you may have to think of other ways. Yeah.
And also, I just mentioned cognitive behavioral techniques as well. There's hot flushes, and they can help with anxiety, changing how we think and learning to relax.
Just going back, Rachel, these high doses of estrogen, when you use high doses of estrogen, one needs to also be cautious that your progesterone may need to be increased. Not your standard progesterone. So, for example, if someone is on this 125 Everoel patch, rather than taking utrogestan 100 milligrams every day, I would even suggest using 200 a day.
Okay.
Because there is no good evidence of the protection of 100 milligrams with a high dose estrogen. And I think it's to be cautious. It will be not a bad idea to give a higher dose of progesterone.
Okay, so increasing
regime, so that's not a problem.
Okay.
Sequential regime shouldn't be a problem.
Right. Okay. I think we're meant to finish at 8, but I think we said we could fit in one more. Yeah. So let's have a look. The two most popular are still a sex drive one and a losing weight one. I think the losing weight is more of a comment. I'm really struggling to lose weight. I lose about a quarter a week and then put it on again. I've put on 2 stone during menopause.
was there something about implants? Was someone asking about implants? Did I
Yeah,
see?
look, I think that's one of the ones that was sent in earlier. So I'm just having a look. There was one about mine. I'm not seeing the implant one on the one submitted. Oh yes, hang on. Interested in advice for those who've struggled to find a suitable estrogen due to sensitivity and side effects? What place do implants have in such cases?
Yeah.
Post-hysterectomy, having successfully used utrogestan vaginally before surgery with testosterone, and I've had side effects from androfeme.
Yeah. I'm a great fan of implants. I used to use a lot of implants in when I was working in the NHS. Uh, I have just managed to convince the Nuffield, and now we have it available.
Okay.
The biggest problem with implants is you get a condition called tachyphylaxis. I'm sorry, there is no easy term to use than tachyphylaxis. And what that means is women get tolerant to the estrogen, and in spite of having good levels of estrogen or high levels of estrogen, they still get symptoms. And the only way around that is to just start reducing that. And that's a difficult thing for patients sometimes.
Right.
But it's not a common effect I have seen, and I've used lots and lots of implants. Once women get an implant, it's very difficult to get women off implants because it works very well.
Mm-hmm.
Okay. Uh, it is more invasive because you need a local anesthetic, make a cut on the tummy, insert it, and put a paper stitch, uh, and that lasts for 6 months. We
Right.
tend to do estradiol levels. That's one of the few times I do blood tests. So estradiol levels. We also have testosterone implants that we use, which is quite effective. So yes, I would say implants is worth a try for that lady.
Okay.
But go with a small dose, like 25 milligrams, rather than a very high dose, because one problem is once you put an implant, unlike a patch or tablet where
Mm-hmm.
you can stop taking it, you can't take the implant out. It will be like finding a needle in a haystack trying to make a cut to find that implant. So that's it. So if someone is worried about being very sensitive to hormones, use a small dose like 25, and then titrate that up.
Okay, so you recommend implants but start with a small dose.
Yeah.
Right. Thank you. I'll just fit in the top two. So Jane is asking natural remedies in inverted commas. Any evidence or recommendations?
I don't know what
Mm.
you mean by natural remedies. So yes, not drinking too much hot stuff, having light clothing, exercise. Those have all been shown to be effective. If she means non-hormonal treatments,
Right.
there are some that have been shown to be effective. Uh, you'll never think I would recommend it, but there are antidepressants, the SSRIs that are being shown to be effective, clonidine, gabapentin, black cohosh, uh, and things like that. There is also the phytoestrogens, and maybe that's the other natural one, the soya.
Soya products, yeah.
Now, this all came about many, many years ago. There was people noticed that women in Japan didn't have as much menopause symptoms, but when they moved across the US, second generation Japanese would have just as bad menopause symptoms. They looked at why this is, and then they said, oh, maybe it's their diet. And then they found one of the things their diet had a lot of is soya. But the Japanese diet of soya is extremely high. So eating a slice of soya bread is not going to sort that. It's part and parcel of their diet. So maybe that's, and soya we know has phytoestrogens in it.
Yes, and just so the phytoestrogens, to explain, is estrogen that we can find in plants and eat.
Exactly.
Eat
Thanks, Rachel. You're very good.
I'll just translate because I don't understand half the medical stuff. So, okay, and I saw some thumbs up when you mentioned the natural remedies like wearing layers and exercising, eating healthily. I've heard that reducing alcohol and caffeine can help as well because they can make hot flushes worse. I don't know.
Yes, definitely.
I certainly notice I can get drunk on one glass of wine now, whereas before, so my alcohol tolerance has decreased. So I've decreased my alcohol intake.
Rachel, I'm not going to get into that because you and I were students in university together.
Yeah, let's move on quickly. But yeah, basically we have to change our lifestyle as we get older, it sounds like. What we drink and what we eat. And there's no easy way around that, folks. But you're not alone in facing that. We have to just take this as a new stage in our lives. Okay, I think we'll have one more, Mahesh, because I realize we're 10 minutes over. Night sweats. I am awake between 2 a.m. to 4 a.m. most mornings. It is causing fatigue. I'm not sure if that's a question or something you can comment on. Tracy is having night sweats and is awake for about 2 hours.
Yes, it's a good point because if one doesn't have a good night's sleep, you are fatigued the next day, and then you have cat naps, and then you don't fall asleep at night. So it's a vicious cycle. So just for that reason, taking something for the night sweats in HRT wise, and that's the useful thing of using something like estradiol, where you can titrate it and you say, okay, I'll put an extra measure at night to try and ease my symptoms, but I think it's worth trying that.
Okay, so varying the amount. I'm just explaining what titrate means, and so having a bit more at nighttime.
Exactly.
Will help with the sleeping. Yes, and I think just reading up on sleep hygiene I found helps, so that when I am awake, just sharing my tips. Please share your tips in the chat. I just try and tolerate.
Jane Henderson has queried homeopathy.
Oh, yeah.
Now, I don't have a lot of experience with homeopathy, but when I was working in the menopause clinic at Stob Hill, women who were clearly not able to take HRT, say they've had breast cancer or something, and they had no help with any of the non-hormonal regimes. I used to refer them to the homeopathy hospital in Glasgow, and about 50% of them felt better. It doesn't do them any harm, and I think it's worth a try. Unfortunately, homeopathy services within the NHS, Glasgow was one of the few places that had a homeopathy hospital. I think it's the only place in Scotland in the NHS. I know Bath had one down south. So it's not something that's commonly available.
Okay, we're going to have to stop because we're over time. I can see lots of interesting questions. Folks, in a moment, I suggest we go to the lounge and we can